you for those joining us live and those also that will be listening later on to this FIP webinar. I'd also like to warmly welcome our guests today, whom I'll shortly introduce, and you will be happy to hear that we have a very good panel today for you to listen about our topic for today. Our webinar is titled The Role of the Pharmacist in Chronic Obstructive Pulmonary Disease. So we will be talking about this topic specifically. As you all know, chronic obstructive pulmonary disease is a very common chronic respiratory disease that requires comprehensive care. Pharmacists obviously have a role to play in the prevention, care and management of COPD. And this event aims to highlight the key role of the pharmacist in COPD by providing insights into medication optimization, inhaler technique, and patient counseling. Participants will also learn about the COPD Right Care program, a global social movement initiated by the International Primary Care Respiratory Group to improve care for people with COPD, and also the Speak Up for COPD campaign, which aims to raise awareness and understanding of COPD among health and policymakers by amplifying the voices of patients, the COPD community, and the public at large. Well, but after just mentioning briefly what the webinar is about, let me first introduce myself. So I am Emma Paulino. I'm a community pharmacist from Portugal. I have previously been involved in FIP at various positions, and now I am president of the National Pharmacy Association, which is the Pharmacy Owners Association in Portugal. At the same time, I'm also proud to say that I'm also part of the board of the International Primary Care Respiratory Group. So we really have pharmacists sitting at the table when we are talking about a very important movement that you will be hearing about later on from Sean Williams, who is the Chief Executive Officer from that organization. So, as I've previously mentioned, for this event, we are joined by a panel of fabulous speakers, and I wanted to sincerely thank each of them for taking the time to prepare their presentations. And I am sure you will be amazed by what they have to present and by the profound reflections that they have made about control of COPD and how healthcare professionals can further work in collaborative care in order to improve patient outcomes, and also hear about how different organizations, as I've mentioned, are also contributing to this collaborative approach. So I have a few announcements for you today. So please note that this event is being recorded and live streamed via YouTube. The recording will be available on our website. So this is the website that you can visit also not only to access the recording of this event, but if you are curious to learn about other events that FIP has organized, you can also visit this website. You may ask questions, and you are asked to ask these questions by using the question box that is provided to all of you in this Zoom platform. You are obviously also welcome to provide feedback to this email, so webinars@fip.org, if you have any suggestions, recommendation about the flow of the webinars or any other type of recommendation for us to improve the way that we interact with you, that would be great. And you are also obviously welcome to become a member of the International Pharmaceutical Federation by visiting our website. And you have information also about the benefits of becoming a member. So please do visit the website to obtain more information about all that the FIP can do. And by being an individual member, you may also become more involved in the work of the organization. So I have a very important acknowledgement. We sincerely like to thank AstraZeneca for supporting this event through an unrestricted grant. And AstraZeneca has really been supporting the advancement of care for people with COPD. And this is one of the ways that AstraZeneca is doing so. So for today's program, we start with, a short welcome and introduction by myself, as I've mentioned. Then we will move on with the first presentation about the Speak Up for COPD campaign, understanding and raising awareness of COPD. Then we will have a presentation about how can pharmacists participate in COPD right care from the organizations that we have already mentioned, and I will be presenting the speakers better when it's their turn to present. Then we will move on with a presentation on how pharmacy teams can support people to live better with COPD, and finalize with an overview of FIP publications that support the role of pharmacists in COPD. We will then, at the end of the session, have a moment for discussion and Q&A. So please, as I've mentioned before, use the question box provided, and we will be able to answer hopefully all of your questions, either in written or orally during this presentation. And then we will wrap up and conclude approximately 1.5 hours from now. So we have obviously a number of learning objectives for you for this webinar. So this is how you will be able to evaluate, to assess whether we have been successful. What we will want you to learn about is the role of pharmacists in the prevention, identification, care, and management of chronic obstructive pulmonary disease. Also, because they will be presented all the FIP publications that support the role of pharmacists in the prevention, identification, care, and management of chronic obstructive pulmonary disease, including tobacco cessation services, because as you will see, this is an important part of any prevention program regarding respiratory diseases and COPD in particular. You will also learn about the COPD Right Care Program, a global social movement initiated by the International Primary Care Respiratory Group to improve care for people with COPD, and the Speak Up for COPD campaign, which aims to raise awareness and understanding of COPD among health and policy makers by amplifying the voices of patients, the COPD community, and the public. So you can see that each one of these learning objectives is directly associated with each one of the presentations. And I'm sure that by the panel of experts that we have here today to contribute to the discussion, that we will be able to reach these learning objectives by the end of the session. So let me now move to introduce our first speaker, who will provide a presentation about the Speak Up for COPD, understanding and raising awareness of COPD. So Tonya Winders is participating today. She is the president and acting CEO of GAAPP, GAP, the Global Allergy and Airways Patient Platform, which represents 110 patient organizations in respiratory and immunology. She has over 20 years experience and more than 70 peer-reviewed publications. It is a great pleasure to have you as our speaker today. And Tonya, the floor is yours. And let me start by thanking you and also congratulating FIP for having a patient representative speaking first about what the needs, expectations and preferences are, and how they themselves are contributing to the different ways that we are nowadays approaching respiratory care. So thank you very much for your participation, and Tanya, the floor is yours.
Thank you, Emma. And again, thank you to the organizers and to FIP for this opportunity to share with you a bit about the Speak Up for COPD campaign on this World COPD Day 2023. Next. So first, what is the Speak Up for COPD coalition and campaign? It is a multi-stakeholder group that you can see here is comprised of patient advocates, professional societies, and industry partners and representatives. And we share a single mission to amplify the voices of the COPD community with really that goal of establishing COPD as a public health priority. And what we know, again, is that COPD impacts over 400 million people worldwide. It is the third leading cause of death, and yet it is often under-recognized and under-prioritized. And in fact, this year alone, close to 3.5 million people will die from COPD. And many, many policymakers don't even know what the term means. So that's why we came together to form this coalition and to really leverage emotive storytelling, evidence-based solutions, educational content in a coalition-led platform to really drive the change that we need. So public awareness and understanding, optimal care, really taking a look at evidence-based engagement and approaches, medical engagement and approaches, and also having those discussions with policymakers. And so we'll be sharing some of our strategies that we've employed over the past 2 years since the COPD, Speak Up for COPD Coalition has been in existence. Next. So this is the timeline of the coalition. We came together first in July of 2021. We actually had a number of stakeholders at the table at that time. Again, multi-stakeholder coalition, recognizing the importance of care coordination and the team, and the very important role, of course, that pharmacists play in that coalition. In November of 2021, we actually launched our first World COPD Day activity with the Speak Up for COPD policy awareness campaign. And then we had continued growth in 2022, where we added partners and we really framed up our engagement framework, formed some coalition governance and norms in early 2023, and then moved forward with a project in 2023 that you'll hear more about in just a few moments, our Ipsos Mori polling activation, where we actually polled across a number of countries to learn better what policymakers understood about the disease COPD. Next. These are some of the key achievements that have happened over the last couple of years. We developed a website. We published quality standards in COPD. We convened an advocacy roundtable. Certainly have developed a very comprehensive advocacy and speaker toolkit so that advocates across the globe can have a uniformed way of talking about COPD. It has digital assets, template letters for policymakers, a campaign flyers, speaker slides, fact sheets, a whole host of content, really to, again, have consistent messaging around COPD. And then last year on World COPD Day, we launched a joint declaration, and I'll highlight that more in just a moment. And then again, moved the Ipsos Mori polling activation forward in 2023. And in August, had a Politico op-ed that highlighted the findings of that Ipsos Mori polling across numerous countries. Next. So this is the joint declaration. It really had a call to action around the significant burden of COPD, establishing COPD as a public health priority, supporting implementation of national strategies that would aim to, again, line up and prioritize COPD, similar to areas like oncology or diabetes, and establishing what good care truly looks like. And then driving that comprehensive standard of care through those quality measures, standards, and other activities. And again, you can see the full declaration at the Speak Up for COPD website as well. Next slide. Looking at the key activities of late 2023 and what we're doing at this point in time, again, we held some key activities at the European Respiratory Society Congress, as well as had a number of speak up opportunities throughout that time frame. We convened our coalition. We also, on World Lung Day, began to really organically circulate key messages for raising the awareness of COPD. And then in October, we held a policy workshop with various member states across the globe to better understand what is meaningful to policymakers when trying to change healthcare prioritization and advocacy. This month, in November of 2023, we have a team that is attending the Gold International COPD Conference in Philadelphia, Pennsylvania, in the United States. And of course, today, COPD Day, November 15th. And so we've got a number of assets that are launched today as well. And then we'll be moving forward in 2024 with what we call a global state of COPD policy report. And we'll have several updates to our website and additional assets for the toolkit. So the Ipsos Mori metrics and results. Again, this was a multi-channel campaign that really helped us to amplify the findings of the polling across the 10 different countries. And what we saw here again is that we had great pickup of this across social channels, across traditional media channels, and that the article actually attracted more than double Politico's typical benchmarks for content of this sort. So really successful aim at just raising the awareness that COPD is a public health crisis and needs prioritization. So we also engage patient groups and clinicians to really raise that global awareness around the burden of COPD. We saw very high click-through rates, 3 times more than the typical benchmarks. You can see here there was linking from AstraZeneca's website and others of the Politico article. The 110 Global Allergy Airways Patient Platform patient organizations also amplified this across their platforms. And here you can see across the world, tremendous social media engagement around the Ipsos campaign. As I said, we hosted a number of policymakers from across the world in October of this year, so just a month ago, and really tested out some different messaging on how to break through the political inertia around COPD. Again, we know that most policymakers don't even know what the term means. Less than 1 in 3 know what the term means. Most policymakers do not realize that 50% of the 400 million people living with COPD have yet to be diagnosed. They also don't know that 1 in 3 never smoked. Most people, if they do know about COPD, think it is solely a smoking condition. So many different facets of understanding the disease and getting the feedback from these various policymakers and stakeholders across the US on how we advance the message and drive change towards these recommendations that we're aiming for. So on today, World COPD Day, across the globe, I'm sitting in Singapore, have had a day full of activities here, but also all the way back to the West Coast of the US already today. So there are individual activations of our coalition members and collective activations. So we have a Why COPD video today that was released on all of the social channels. We have a Politico op-ed article that was released today as well, and then all of the activity at the Gold Conference. And we also are celebrating alongside Gold the release of their 2024 update with key inclusions on things like spirometry, inhaled medicines, the inclusion of COPD screening and lung cancer screening programs. And so again, a lot of progress being made in advancing the standards of care of COPD. Right now, we are launching a social media challenge. And so it's a Speak Up for COPD Bubble Challenge. And again, if you go to GAP's social channels, either LinkedIn, Twitter, Facebook, you'll see, or our website, you'll see these assets. We also can circulate them. FIP has them in a very easily downloadable one pager where you can speak up for COPD. You can help to raise the awareness across the world on the importance that breathing is life, and it's important to act early. No matter where a patient is in the journey of living with COPD, we know that there's opportunity to act sooner. I myself am a caregiver for my mother who's been living with COPD for about 5 years, and it took us quite some time to get that diagnosis and the appropriate treatment. And so I know that this is the shared story, shared life experience of so many hundreds of millions of patients living across the globe. So as we turn the corner to 2024, again, our key mission will stay the same. Our main objectives will stay the same. We will work collectively alongside FIP and other partners, as listed here on this slide, to continue to amplify the voices of the COPD community and to establish COPD as the public health priority that it should be. And with that, I thank you, and I'll turn it back over to Emma.
Thank you very much, Tanya, for this inspiring talk. Thank you for sharing all this information, and congratulations on the great achievements and the great work that you are doing. And I'm sure that we will have some questions for you later on in our Q&A session. Thank you very much again. So I will now introduce our next speaker. It's Sean Williams. An accomplished public health manager, Sean has worked to achieve large-scale change. Oh, sorry, that's a dog. That provides value for the individual, health system, and society. So in her experience, there is significant scope to improve value and equity in respiratory care if we collectively engage all parts of the system in all geographies and apply the best evidence about clinical and patient behavior change, delivering right care to the right patient at the right time in the right place. So I have been personally witnessing how Sean makes all of this happen and how she's a great facilitator of change. And I'm sure she will deliver an inspiring talk about why you should also join the movement. So thank you very much, Sean. The floor is yours.
Thank you, Emma. It's lovely to see so many people from so many countries. So welcome to everybody today. I've got control of the slides, so I will be taking you through COPD Right Care, which is, as Emma said, a social movement that IPCRG, the International Primary Care Respiratory Group, has developed, specifically thinking about how pharmacists can participate. I don't have any personal disclosures. IPCRG's program was started by IPCRG. We have had funding in the past from Boehringer Ingelheim and also from AstraZeneca. So the real question is, what does good quality COPD care look like, and how can pharmacists contribute? And that QR code should take you to a lot of the resources that IPCRG offers. So what do we mean by right care? Well, we mean, as Emma said, it's the right things and only the right things. We don't want to over-treat, in the right way for the right people, at the right time, in the right place. And that means something different in all of your countries because the contexts are so different and the role of pharmacy is so different. But here are some examples of the range of high-value interventions in COPD, pulmonary rehabilitation, for example, the use of pulse oximetry to identify those people who may be in respiratory failure and who need oxygen. Also, tools such as the mHealth work of WHO in helping people quit tobacco. That's Florence. I think I preferred what Florence looked like before she's changed in the new AI world. Why do we need right care? What's the issue? Well, there is persistent, unwarranted variation. That's to say, it's not due to patient difference, it's due to healthcare difference. So we need to offer practical tools that can raise awareness of COPD, as Tonya described, that build competence for in healthcare professionals, and perhaps even more importantly, build confidence so that they actually feel confident to take action. And so ultimately it becomes easy to do the right thing. So the approach that IPCRG has taken is based on these 7 ideas, and I'll go through them all in detail. But the first is that we believe things should be driven by primary care. That's where most people with chronic respiratory diseases like asthma and COPD are seen. We should learn from social movements for help that can mobilize all stakeholders. We need to learn about followers and first followers. We must bring joy to work. Everybody's tired after COVID. Everybody's exhausted. Pharmacists, you were open so many hours in a day. So we've got to make it joyful to do this work. We need to operate at scale. We need to teach the teachers so that they know how to teach future generations and the people currently in practice with many years of behaviours, some of which are good, some of which may need improvement. And we need to think about where the high value interventions lie. So let's go through those. So firstly, we believe in primary care. This is WHO slide, which just says that about 80% of care for most non-communicable diseases, and including COPD and asthma, can be delivered in primary care. And that's over their whole lifetime. It can deliver through the life course from primary to quaternary prevention. Social movements, that's the second thing. So we were heavily influenced by a report by Nesta, which is a think tank in the UK, and it looked at the number of social movements for health around the world. And it said, it's about art more than science. There's no curricula, there are no rules, there's no guarantee that what we do will be successful. But it's about power, it's about reading power, and it's about building relationships and mobilizing issues. And that's what we set out to do, to mobilize as many people as possible. And it's great to see the number of people on this call today. And the good examples are things like the Green Movement, HIV movement, and lots of disability rights. So many of you, I think, will have seen this very famous YouTube film. And if you haven't, I highly recommend it. So this is saying that the first person who comes up and does something is really important, the leader. But actually, they can be just a bit of a lone guy. What needs to happen is people need to follow. And actually what happens is the first person who chooses to follow is the very brave one. So in this video, you'll see this guy dancing, and then he's on his own. And then a person gets up and joins him. And as soon as that second guy joins, that's when the masses come. So we want masses, we want big scale change. So it's about the first follower. So we've got to find them. Bringing joy to work. So these are examples from our Portuguese group. This is for World Asthma Day rather than COPD, but the same principles apply. They organised walks and talks for the community, and community pharmacists were very involved in their own towns, setting this up. People have got T-shirts on, they're talking about asthma, but they're walking, they're walking and talking at the same time. So they're understanding the connection with physical activity. So it was all ages that got involved. And then they ran it again this year. Lots of children's groups were involved. And also our group in Brazil took on the idea as well. So Camin Asthma, this idea of walking with asthma, took off there as well. And we've seen examples like this all over the world, with the creativity of primary care coming to the fore. We can all make change happen, but it's often small scale. But if we're really going to make a difference, we've got to go big. So here, that we've got to go to as many geographies as possible. We have to go to as many parts of the system as possible. And we have to go deep. We have to change behavior, not just get people better informed. And the pervasiveness is important, because this is where pharmacists come in. They're a key part of the system, the respiratory system of care. The behaviour that I mentioned in that previous slide, here's an example that we've been working on with Asthma Right Care, which is about thinking differently about specific opportunities, the teachable moment. So this is when a person comes in and asks for a short-acting beta agonist over the counter. How can the pharmacists turn that round into a teachable moment where they explain that that might not be the right treatment for them for their asthma, and maybe they need a review. So we've been working to share examples of that. And here's one of our Spanish group created a video, a how-to video on that.
Hola, buenas tardes.
Right, I need to move off that one. Yeah. So, but we know that achieving competence doesn't happen overnight. You know, we can see people doing the right thing and we think, gosh, that looks easy. But then when we try it ourselves, we might find it's a bit harder than it looks. That consciously incompetent phase is really difficult. And so we know that, and we want to try and provide the support to overcome that feeling of discomfort. And we need to offer people ways to practice and to get better so they become consciously competent. And that's something that is very motivating for all of us to get better at having a conversation. And our goal is to get to the point where we don't even need to think about it anymore. We're unconsciously competent in doing the right thing in the right way. But we perhaps need to go one step further, and we need to find the teachers who are confident that they know all of those stages and they know what resources and support people need at each stage. So we therefore run these teacher programs so that we can really build teaching capacity around the world. The final thing that influenced us was the value, the concept of value, which is more than cost effectiveness. It's about what brings the outcome we require at the best and most affordable cost to the system. And that might be time, it might be money. And so we did this over 10 years ago now in London, and Darushu Follows was also involved in this work, which was published in Thorax. And we looked at the high value of the flu vaccination, of stopping smoking, so we would call that treating tobacco dependence, of pulmonary rehabilitation, and then the inhaled medicines as well. Since then, some of those, the data on cost has changed, so I'm not suggesting this is still accurate today, and we've added other things that actually, at the bottom, we need leadership to build trust between different parts of the system. You know better than I do that in some countries, doctors wouldn't trust a community pharmacist to be part of the system. So how do we build that trust? And then we need education and training to underpin it all. We have a right care strategy group, and that group is clinicians from around the world, and Darush is part of that and is talking next. We collectively created something, a one-page document called What Does Good Quality COPD Care Look Like? From the perspective of the patient, but addressing primary care. What can primary care do to address that? So 9 of the statements are about the management. What do people with COPD deserve? And the first one is, what do people with exposure to the risk factors deserve? And you'll see here some of the resources that we've created. We've got a How We Breathe video, which yesterday was launched in Bengali, for example. So we're happy to consider new translations and transcripts. How do you treat tobacco dependence? Absolutely critical. It prevents it, but it also treats it. Then I've just pulled out the ones most relevant to pharmacy. So people with COPD deserve long-term holistic management according to the guidelines, which update every year, the international ones. Includes vaccination, counselling and treatment if they are tobacco dependent, pharmacological and non-pharmacological treatment, and then referral to pulmonary rehabilitation. And many will need end-of-life care at the far end of their journey. And we've got resources that you can see supporting all of that. This is the gold guideline. Now, this is the 2023 slide set. I don't think it's changed. It was reissued with the new 2024 yesterday. But what we've done is create other tools. So I don't know if you can see me holding this up with it, probably not with the background. Here we go. This is our COPD wheel. And this is a different way of showing that same prescribing information and giving prompts to prescribers. We've also produced this information about the role of ICS, because these are overused in our experience in COPD, inhaled corticosteroids. We've given information about multimorbidity and in particular the issues of polypharmacy and what needs to happen there. So again, we've got good resources for you to have a look at. And here you go with the considerations. People with COPD deserve to be offered appropriate inhalers according to their abilities and appropriate inhaler technique training. This is a clear role for pharmacists, and the more you can help people, the better. And Right Breathe is one of the resources we recommend, and Darush is instrumental in that, so we'll tell you more. Vaccination, so another area of strength for pharmacy. Just to let you know that there's been discussion about whether RSV vaccination should be included, and it was yesterday. It appeared in the gold guideline based on the American CDC guidance. So that's 6 vaccinations now which are recommended for people with COPD. An individualized management plan, so taking into consideration their life and what they need to cope. And we've produced a magazine, a digital magazine called Breathe Well, Move More and Live Better. That's available in lots of languages at that link, and you're welcome to download it. And please suggest it to people you know with COPD. The second edition is in progress, and that's focused on mental health, mood, motivation, fatigue, energy, nutrition, sleep, good sex life. And then the third one will focus more on exacerbations, flare-ups, and so on. It's a great resource to use. It embeds the videos which we've curated from other places. I showed you the wheel. So one side is for prescribers. The other side is for people with COPD. And it's the sorts of questions that we know people ask, and it's a prompt for clinicians about what are the answers? What do you need to know about? How can you start thinking about how you give that information? And so to summarize, this is what we call for. We call for governments and payers in all countries to invest in primary care because we believe this is the right place. To invest in the management of chronic respiratory diseases in particular, because this is a huge issue. So the diagnosis and the management. But to invest in training and education because there isn't sufficient there. And it's in the how-to type of education. And that's my reminder to stop. In integrated systems right across the pathway. In generating real-life evidence, you know what really happens in pharmacy. What do people ask you? What medicines are they actually taking? We think that primary care can be population health educators, but people need incentives. Primary care is not sufficiently incentivized to practice population respiratory health. And obviously, every country needs to be able to include in their universal health coverage access to the right treatments and training for respiratory care. And we believe organisations like FIP and IPCRG are in a really good position to leverage change if we've got the support to do that. We agreed this with the Family Doctor Association of Europe, called WONCO. And then finally, a plug before I finish, and that's to say we have our World Conference coming up next year in Athens, and it would be great to see some pharmacists there. And if any of you are researchers, then consider submitting abstracts to us there. Thank you very much.
Thank you very much, Sean, again, for a very good and inspirational talk about how pharmacists can be involved in the different ways in which we can do that. And I'm sure that Darush will further demonstrate how pharmacists can in fact make a difference. And before I introduce Darush, let me just take this opportunity also to really suggest and recommend that you attend the conference that Sean has just mentioned, the International Primary Care Respiratory Group World Conference. It's a really nice opportunity to interact in a multidisciplinary fashion with other healthcare professionals that have the same goals as we are, as we have. So I really recommend that you take note of this conference and so that you can attend if you are able. So now I will move towards the next presentation by introducing Darush. So it is my great pleasure to introduce our colleague, Darush, who's a clinical fellow respiratory lead pharmacist for the Imperial College Health Partners, NWL Asthma Network, Children and Young Europe, and NHS Right Breathe. He is co-chair of the Task Force for Lung Health Medicine's Optimization Group, PCRS Conference Chair, and part of the Executive Committee. He has presented at various national and international conferences, many interdisciplinary and pharmacists conferences like ERS, IPCRG conferences, and many other organizations. I have had the pleasure to attend some of his lectures, so I'm sure you will enjoy it as much as I always do. So please, Darush, the floor is yours.
Thank you very much, Emma, for that lovely introduction, and great talks before as well. So I'm going to talk about how pharmacy teams can support people to live better with COPD. And I think what Sean was saying in the previous talk, you know, what do people with COPD deserve is really, I think, all of our missions to support patients. So I'll just move the slides, and these are some of my disclosures. And just to really start off with, I'm based in England, and in England, pretty much every single community pharmacy, and that's my heritage, where I started off and graduated as a pharmacist, and absolutely passionate about pharmacy. And one of the things I noted is over the years, more and more services were becoming more available in the community pharmacy. And what I've realized was what is important was the whole team effort, and also linking in closely with our GP practices, highlighting that we're skilled professionals that can support patients live better with their lung conditions. And as the data was coming out more and more, we were starting to get more advanced services. And one of the things I've been really passionate about, and I think for World COPD Day, a lot of our patients living with COPD will be, unfortunately, tobacco dependent. And the good news is that there's a lot of support and treatment that's available to support our patients. The other thing is to think about is that it's not just treating tobacco dependence. A lot of the non-pharmacological support we can offer will be around weight management services, around lung health checks, and also having those sort of health promotion zones, which I'm going to share with you on the next slide. And this is something that we're seeing more and more often around self-care and how patients can take better care of themselves. And because in England, we say you're never more than 20 minutes away from a community pharmacy, and I'm sure across the globe as well, there's many accessible places where patients can get that support. So this is just an example of a health promotion zone that the pharmacy I was working with in West London. And what I like about this particular zone is that we can do some screening, we can do some education awareness. We've got resources to hand, like the wheel potentially that Sean was showing earlier, that wheel which explains what is COPD. There's a lot of patients who do not know what COPD is, and they've been given this label. There's tools that will help us just to show that it's a treatable and manageable condition, and it's never too late to make changes. So you'll find that, for example, with we talk about the missing millions as well in England, where we've got about 1 million people diagnosed with COPD, but there's a couple of millions who haven't got that diagnosis yet. So what interventions can we do? So things like carbon monoxide machines we have available to check to see exposure to pollutants. But of course, cigarette or water pipe, shisha type smoking exposure is something that we can look at. We could look at, for example, at the patient's symptoms and well-being. If a person is coming in with breathless symptoms or they're getting repeated cough mixtures, there's lots we can do or asking around how often, how many courses of antibiotics have you needed, or courses of oral corticosteroids. We may have noticed that somebody who's breathed into a lung machine, like a microspirometer, we could potentially, if you've got those facilities available, check to see if there's any early signs of lung obstruction, or checking things like pulse oximetry, oxygen saturations. So there's plenty we can do just around screening, and there's questionnaires as well that we can use, in addition to all the things that a lot of us community pharmacists are specializing in, which will be around inhaler technique optimization. So these are some of the tools you may have come across, like the MRC or the Modified Medical Research Council questionnaire, which looks at levels of breathlessness that we could utilize. These are short questionnaires just to see how the breathless symptoms may be affecting that patient. And we can see what the severity is and how it's getting in the way of the person living their lives. We could look at the COPD assessment test. We could have in our health promotion zone a leaflet that talks about that 9 out of 10 patients may make a mistake when using one of these puffer type of inhalers, and that actually with a spacer device, lung deposition can improve with inhaler technique coaching. We can help patients understand more about the inhaled medications they're on and whether they may need, for example, inhaled corticosteroid cards, for example. Red flag symptoms are things that we may be aware of to think, actually, this doesn't sound like it's COPD, it could be something else. So have we noticed sudden weight loss or blood in the sputum? Finger clubbing, for example, which we could observe. So there's lots of things, and also the impact on the patient's lives, because we know that COPD and lung conditions in general, outcomes are worse in the people who are poorest in our society. So is there anything we can do to support and signpost on to other services? And for example, if the microspirometry did show some abnormalities, then we could potentially refer on to have some proper objective tests like spirometry done by a person who's trained. So an acronym I like to use is something in my mind is, I think, for the person living with COPD, what matters to them? What's important to them? It might be that for them is to walk Emma's dog, you know. I heard the dog in the background. So that's what's important to that person, is being able to walk around and do that. But we won't know that unless we've actually asked that patient those type of questions. And what would they like to achieve? What are their goals? And so that person's mental health and physical health are going to be really important to them. So this is what it's all about. It's importance of involving the patient in all of these discussions and not seeing them as just a pair of lungs. But of course, we want to reduce disease progression and reduce the number of exacerbations or lung attacks a patient may have, and ultimately reduce mortality. The words we use are really important. And I think with the goal guidelines and or the strategy that gets updated, there were times when they used to use words like, this is an irreversible lung condition, which for some patients, if they look at all of these words, they'll think, what's the point? Why should I bother stopping smoking? Why should I bother with lots of things and become even more depressed? So it's really important that we use positive terms as well, really helping people live well with the lung condition, which is possible because it is a manageable and treatable. And if you look at the GOLD strategy definition, it does really talk about these terms and how we should be utilizing these in community pharmacy as well as other settings of pharmacy as well, just to really educate and empower patients that it doesn't mean that's the end. There's still lots of living to take place. So this is why I've been so delighted to work with IPCRG and FIP, but especially with the COPD Right Care social movement, trying to make more noise about how we can stay active and not using the word exercise, for example, using increased activity that's manageable for the person, the importance of being protected with the vaccinations, and of course, managing the medications which some patients are going to obviously be on, but knowing that the non-pharmacological treatments are the first sort of things we should be looking at ahead of these sort of inhaled treatments as well, but treating them as equals. So there's tons of resources, and a lot of them, because we're under so much pressure in our settings, what you might find is using a 30-second type of approach is very helpful, and it's evidence-based. This is talking about the evidence-based ask, advise, and act approach that you can use when approaching smokers. So we can ask a person if they smoke. We can advise a person if the best way to stopping smoking is a combination of support and treatment, which hopefully will be available in your countries. But there will be hopefully some form of support, and community pharmacies generally will have over-the-counter treatments that are available, and they may have national helplines as well. Rather than saying things like, oh, you must stop smoking, smoking kills, or whatever, it's really important that we use positive language that can be done in a timely manner. And this is why we call it the ask, advise, and act, 30 seconds to save a life, and acting according to what's available in your country. And it might not be smoking, it might be actually oral tobacco use or other forms of tobacco use as well. So other things that we can really promote, and Sean was talking about the introduction of RSV vaccination as well. But for smokers, I normally, if I'm offering vaccinations, I would say that did you know you're 5 times less likely to get flu if you're a non-smoker? You can really, for COPD patients, you can bolt on this extra bit of advice that's tailored for our patients. You're twice less likely to get pneumonia if you decide to stop. Very positive. And if you're a non-smoker, you're less likely to get more severe complications of COVID-19. Believe it or not, smoking can make your inhaled treatments less effective, especially if they're contain inhaled corticosteroids. So this ask, advise, and act, 30 seconds, really sort of some things you can utilize. I like to use words around vaccines or treatments, because we do have treatments for COVID-19 across the globe as well. Check to see if they're eligible. And I've checked their date of birth and any other medication that they're on. And if they happen to be in that age group where they're entitled, or if they're in that medical, they have a medical condition that qualifies them for vaccination and treatment, then that's brilliant. Word we might want to avoid is just saying you're at high risk of having, worse outcomes if you catch COVID or influenza or RSV, because it might be quite scary. So using different positive language, like you're eligible or you qualify for vaccination, may be a good way of approaching it. So the words we use are really important. And would you like me to refer you on? So I think one thing I really love is tools and resources. I'm always already surrounded by inhalers where I am, even here, and spacers, for example. But I also find that actually the lung tubes that I like to use in these health promotion zones, just to help patients understand where the airways begins and how it works, and how actually, it can potentially be life-threatening if not treated appropriately. And in the community pharmacies, we've got plenty of advice and that we can provide our patients. So I'm not going to go into this because I'm conscious of time, but it's just a pyramid that I helped put together for pharmacists working in my local patch in Northwest London, around starting from the bottom of the pyramid, how we need to really get a sense check if a person does actually have COPD, and not take it for granted that they do. So check how were they diagnosed? Was it with objective tests? We can ask these questions. We don't have to do the objective tests ourselves. We can check their vaccination status. We can check whether they've been shown how to use an inhaler, but not only shown, ask them to show us how to use that inhaler, because a lot of people, unfortunately, even after they've been shown, may pick up some bad practice. So if the inhaled medication can't get to the lung, that means 0 to 10% of the drug actually gets to the site of action, which of course means we may step patients up on higher doses of treatment without checking the basics first around inhaler technique. So it's really important to get that bit right. And of course, we can also promote the fact that with better lung control also means good for the patient and also good for the planet with regards to plastic waste, and also less costs as well with regards to our countries and to the system and to the patient. They won't need as many inhaled treatments. So there's lots of things we can do to really promote the inhaler technique, and also highlight that COPD, generally there are other multimorbidities as well to think about. It's common for people to have, for example, depression. In fact, suicide rates are higher amongst the patients in this group, and we need to understand more and more about this and watch for those warning signs. And this is why some of those IPCRG resources that Sean was talking about, I find are really helpful, because they're bite-sized and really good for us just to have, as they say, desktop, really just short, cut 2 sides of A4 a lot of the time. But what I'm finding is we need the skills and we need the training as a profession. And we've gone through our rigorous training to become pharmacists or pharmacy technicians. And we need to be part of that whole multidisciplinary team. I remember the time when I qualified as a pharmacist, I used to apologize to the doctor for disturbing them when I was on the phone to them. That shouldn't be the case. It should be peer-to-peer, equal discussions. And then we're all there to help the patient, and the patient is the heart of all of our discussions. And so that relationship building, inviting patients to our pharmacists to show them around and what we offer, I think is important. So these are my lung tubes I tend to show, and Shana's already gone through the wheel, which I absolutely love. I also really like the COPD magazine, if you ever get a chance to see that. It's got some excellent resources in there, and also just breathing techniques that we all take for granted. Breathing, it's not something that we can all, patients can pick up bad habits with their breathing patterns. So let's always think about stepping back before we step up. I've seen so many situations where prescribers have gone on to giving the highest level of treatment before they've actually asked and done that thorough history taking. So we might find that with asthma, of course, it's a condition of inflammation and needs to be treated with anti-inflammatory treatments like inhaled corticosteroids. But COPD predominantly, and in the majority of our patients, is a condition of breathlessness and needs to be treated with bronchodilation in the majority of times. So let's get that bronchodilator therapy right. But before that, think about all of those non-pharmacological approaches we're talking about. And just to end up my talk is just to highlight the never assume. Obviously, during the pandemic, there has been a lot of lockdown and a lot of inactivity, and patients are becoming afraid to leave their homes. There's such a hard time for a lot of people out there. So we need to do what we can around improving the use of manageable activity and helping people get out there and mobile, because if more activity allows more oxygen to get to the site, to the muscles, and also helps the patient feel start using their muscles better, so the oxygen can concentrate on the site of action where it's needed, which is their lungs. So that is an important part of what we do. And I think the Ask, Advise and Act for this, as again on the IPCRG website, you can ask, how has breathlessness changed your life? What troubles you most about being breathlessness? And we could talk about pulmonary rehabilitation, or we can talk about activity. Increased activity helps you breathe better, feel good, do more, return to work, and I strongly recommend it. It's hard to remember these words, so having a sort of ask, advise, and act like this, I think, will help us in our clinical practice, because we need those sort of making every contact count and 30-second approaches where we can. So don't forget, there's tons of resources available on the IPCRG website. Sian showed some of the main ones that we can use in community pharmacy, but happy to answer any questions, and thank you for your time.
Thank you very much, Darush, for your presentation. And I'm sure that it was obvious to everyone that you are very passionate about these topics. And particularly, we have to recognize your work in terms of the tobacco cessation and bringing tobacco cessation more to the table when we are discussing respiratory diseases. I also have to mention, because I didn't do so when I introduced you, that you have been recognized by your healthcare peers at the 2019 Primary Care Pharmacy Association GP Pharmacist Awards for Excellence. So congratulations for all your work. And another interesting fact from Darush is that he has been working to reduce health inequalities that are caused by tobacco and poor health care, and thus spends a lot of his time teaching in the private locations across the UK. So, and you can see from his presentation that there is really a role for everyone, irrespective of where you practice and the geography and the country and what is allowed by legislation or not. I'm sure that you can find in this presentation a lot of examples how you can get involved, specifically particularly if you are a practitioner. There are tons of opportunities, and like you mentioned, Darush, when you finished your presentation, it's really about making every opportunity, on every contact opportunity counting. So thank you very much for that very positive and engaging message. So we will now proceed to the final presentation, and I'm very happy to present Inês, who is here with us today to make her presentation about the FIP publications. So Inês Nunes da Cunha is the FIP Practice Development and Transformation Project Manager. Before joining the FIP, she has worked as a community pharmacist in Portugal for over 14 years, and she has also taught for 6 years at the university as professor in the Integrated Master of Pharmaceutical Sciences, also in Portugal. She has a master's in pharmaceutical care and a PhD in pharmacy in the area of social pharmacy from the University of Granada. So she's the author of several publications focusing on the area of pharmacy practice, specifically related to patient-centered care. And in FIP, she currently works mainly as the FIP Practice Transformation Program on non-communicable diseases. So she is the lead and one of the authors of the Chronic Respiratory Diseases, a Handbook for Pharmacists, and Tobacco Cessation, a Handbook for Pharmacists. And these are a few of the publications she will be talking about today. So Inês, I hand over to you.
Thank you very much, Emma. And thank you very much to our brilliant panelists, Tonia, Sian, and Darush, for their amazing presentation. So I would like to start to say that it is a great pleasure to be here today to celebrate the World COPD Day and to present FIP publications that support the role of pharmacists in COPD. But before I present these publications to you, I would like to tell you that the FIP has been working for the past few years on the FIP Practice Transformation Program on non-communicable diseases. As you know, the chronic non-communicable diseases, NCDs, like diabetes, cardiovascular diseases, cancer, mental illnesses, and chronic respiratory diseases, including COPD, are the leading causes of disease burden and mortality around the world across all country income levels. And according to the World Health Organization, these 5 NCD cause nearly 3/4 of deaths in the world, and every 2 seconds, a person under the age of 70 dies of an NCD. and 86% of those deaths occur in low and middle income countries. So the FIP Practice Transformation Program on non-communicable diseases aims to provide strategic supports and tools to FIP member organizations to develop and implement pharmacy services that can have a sustained positive impact in the prevention, screening, management, and treatment optimization of NCDs for improved patient outcomes and health systems efficiency and sustainability. While this program has a particular focus on low and middle income countries, it is also encouraged implementation by countries of all income levels, since the goals of optimizing NCDs management and reducing the burden of these diseases are global imperatives. The program includes the development of practice support handbooks, knowledge and skills guides, implementation guidelines and support, and training for competence development in each of the 5 main NCDs areas, and also risk factors such as tobacco use. And today I will show you FIP publications that could support pharmacists' role in COPD. So let's hear, FIP published the Chronic Respiratory Diseases Handbook for Pharmacists, and Darush and Emma was co-authors of this publication, so thank you very much. And the aim of this handbook is to identify and describe key evidence-based interventions by pharmacists in chronic respiratory diseases, including COPD, with the dual aim of supporting their implementation in pharmacy practice and supporting advocacy efforts by FIP member organizations towards the optimization and/or expansion of pharmacists' scope of practice in chronic respiratory diseases and NCDs in general. This handbook has outlined the many ways in which pharmacists can contribute to improving respiratory well-being among their patients, including by acting as agents for health behavioral change and other preventive services, asking patients to take health status questionnaires, like Darush mentioned on his presentation, screening for chronic respiratory diseases, referring patients to additional care, working as part of interprofessional teams, optimizing the use of inhaler devices, for example, inhaler technique education, improving treatment adherence, and monitoring patients for exacerbation episodes and hospitalizations. So this handbook is organized by chapters, starting by identifying the signs and symptoms related to asthma and COPD. We dedicated an important chapter to the prevention and control of these diseases, where we talk about the role of pharmacists in promoting respiratory well-being, how to promote healthy lifestyles and prevent risk factors, and what is the role of vaccination in the prevention and management of chronic respiratory diseases complications. In the handbook, we also present tools and point-of-care tests to support pharmacists' role in chronic respiratory diseases, interprofessional collaboration to support people with these diseases, and non-pharmacological and pharmacological management of chronic respiratory diseases. We also have devoted an important chapter to optimizing the use of medicines, where we address issues such as improving medication acceptance and adherence, evaluating and resolving medicines-related problems, pharmacist interventions on the use of the inhaler devices, like I said before, and developing treatment and monitoring plans. We also included a small chapter about palliative care and end-of-life care for people with chronic respiratory diseases, and IPCRG have a desktop helper just about this topic. And the handbook also gives guidance for practice-based research on pharmacists' roles in chronic respiratory diseases, and also ethical considerations when caring for people living with these diseases. We finalized the handbook with a chapter about the barriers to providing chronic respiratory diseases services, and also the facilitators to overcome these barriers. Together with the handbook, FIP published the Knowledge and Skills Reference Guides for Professional Development in Chronic Respiratory Diseases. This guide builds on the handbook, and it's a companion publication development to outline the recommended knowledge and skills in chronic respiratory diseases for pharmacists, and also to support professional development of pharmacists in this area. In the context of the FIP works on NCDs, it is proposed that this program should also help patients to avoid risk factors for NCDs, such as tobacco use. Tobacco cessation, especially smoking cessation, like Darius said, is one of the most important interventions to reduce the prevalence of NCDs and is particularly important to prevent COPD. So the program has been expanded to include the prevention of NCDs risk factors, like I said, in the area of tobacco cessation. And to facilitate this, FIP published a handbook and also a knowledge and skills guide to equip pharmacists with the necessary tools to provide effective tobacco cessation services. In addition to these publications, FIP is actively working with member organizations such as the Jordan Pharmacists Association and the Indian Pharmaceutical Association to support the role of pharmacists in tobacco cessation at the country level. This collaboration includes workforce development initiatives to improve the provision of pharmacy service in this area. FIP is also working with some member organizations to translate these publications into a number of different languages. So please check our website to more updates. So the negative effects of tobacco use on health are well documented. However, giving up tobacco and quitting can be a challenging process, but the journey towards a tobacco-free life can be made easier with the right supports. And like Darius said, pharmacists have an important role to play in helping tobacco users quit and remain abstinent. Pharmacists' expertise and accessibility ensure they are ideal providers of evidence-based advice, medication, and support to those who want to break their addiction and to break their addiction to tobacco and also dependence on tobacco. So this handbook has been developed as a comprehensive and practical resources for pharmacists to support individuals in their efforts to quit tobacco, emphasizing the critical role of pharmacists in providing comprehensive and coordinated care to patients seeking to quit. It covers the latest evidence-based practice, techniques, and strategies to help our patients quit and not start again. By using the information and strategies outlined in the handbook, pharmacists can contribute to improving public health and reducing the burden of tobacco use on healthcare systems. The handbook covers various aspects of tobacco cessation, including the burden of tobacco use on public health, the role of pharmacists in tobacco cessation, and the treatment of tobacco dependence and strategies for providing effective care to patients. One of the chapters look at the impact of tobacco use on patients with underlying diseases, such as chronic respiratory diseases, and the impact of tobacco use on specific populations, such as young people and pregnant women. The handbook also provides practical guidance on how to conduct patient assessments, design treatment plans, and select appropriate medicines to manage wide-range symptoms. The handbook covers strategies for providing patients education and support, monitoring and adjusting treatment plans, and preparing patients to other healthcare professionals where necessary. It also highlights the importance of interprofessional collaboration and integration of tobacco cessation services into routine primary healthcare. In conclusion, pharmacists should consider how they can integrate COPD services into their approach to care and how these services can benefit their patients. Pharmacists' roles include identifying symptoms, preventing triggers, screening for COPD, referring patients to additional care, working as parts of interprofessional teams, optimizing medication use, and much more. And more. Despite some barriers that exist to implementing some of these services, there are several opportunities for pharmacists to expand their role as public health professionals and healthcare providers by taking steps to prevent, detect, and manage the treatment of people with COPD. Pharmacies and pharmacists are fully capable of implementing these services and should be used more widely to extend patient-centered care and improve health outcomes for patients with COPD. With these publications, FIP hopes to encourage all pharmacists to join the global effort to address the rising rate of COPD. There is enormous potential to improve public health if these services are integrated into practice worldwide. FIP trusts that these resources will contribute towards advancing the role of pharmacists in the prevention and management of COPD around the world, and I hope you enjoy exploring them. So all the publications related to the program, such as the handbooks, the KNF guides, recording of digital events, and other resources can be found on the MCD's microsite that you can see on the slide. And I will also share the links with you on the chat box. So thank you very much. And thank you, Emma, for your moderation.
Well, thank you, Ines, for a very comprehensive review of the contents of these important publications. And I think that this is really resources that are available on top of all the resources that Darush and Sean have also shown, and also Tanya, that we can access and use for our daily practice. So I strongly encourage you to go to the websites and download this information and use it as a practical tool for your daily practice. So now we will open the floor for questions. I will remind you that you can ask questions by using the question box that is provided in Zoom. For now, we still don't have any questions coming from the audience. We just have an observation from Sneha Pandey, mentioning that construction and iron industry or the metal manufacturing industry produce most of the metal dust, which is more harmful to the atmosphere. And we were talking about these environmental factors that obviously have an impact in the occurrence and also control of respiratory diseases. So thank you for this observation, for this note. Since we don't have any questions from the audience, but we still have a few minutes before we close the session, I will maybe start by asking Tanya whether in your experience as a caregiver and also as a person who probably visits pharmacies, I would suppose, do you think that pharmacists are aware of the importance of COPD, and do you think that pharmacists are proactive in terms of COPD prevention and approaching people who have COPD and would require a certain level of care from all healthcare professionals?
So thank you for the question, Emma. Definitely, I think that pharmacists are critical in the comprehensive management of COPD. Most pharmacists, I think, are aware of the disease. They connect the dots of the medications to the disease. But I think that, again, in at least a lot of the world, pharmacists' role is challenging because they may not have the workforce to fully support the need for patient education, inhaler technique training, medication reconciliation, all of these things that are key components. And then you add smoking cessation for those 2/3 that probably do have a smoking history or maybe are currently smoking. It absolutely is an overwhelming task that we're asking pharmacists to do on a daily basis. So I think it's very important that we have the use of tools like were pointed out today to easily communicate the key points around disease management of COPD to all patients living with the condition.
Well, thank you very much. And I think that this only shows how important these moments are for training, for pharmacists to identify opportunities for acquiring new competences, for us to be able to also invest in competent workforce that can really respond to patients' needs and expectations in this regard. And also, obviously, the evolution in terms of the regulation and legislation of how pharmacists can contribute is also important. So definitely we should also involve policymakers in this effort. So thank you very much for answering. We have two questions already in our question box, and there's a difficult and an easy question for Darush. I will let Darush tell us which one is the difficult one and which one is the easy one. So we have a question on whether but I will direct the question to you. If new electronic cigarettes and IQOS are true aids that can help in smoking cessation, or if they are just new trends in the smoking industry. So that is one of the questions. And the other question is whether we have seen screening for COPD being effective when done in community pharmacies. So I will hand over to you, Darush.
Yeah, these are, they're difficult and questions, but what I would say is for the IQOS is different to e-cigarettes. So that's one thing to get across. IQOS is heated tobacco. It actually stands for I Quit Ordinary Smoking, and they're developed by tobacco industry, these things. Electronic cigarettes are not always produced by tobacco industry, and they're different. They generally contain different generations. They're devices that are there to aid some smokers who are current smokers to stop smoking. So there's some Cochrane data that came out to show the effectiveness of electronic cigarettes. So there is more and more data. It's very well becoming more and more research, which is good news. What we don't know, of course, is the safety data, because it's still relatively there's still some unknowns. In England, we basically say that we try a harm reduction strategy. And so in England, there's a strategy to try and help people who are current smokers to try and stop smoking and make the switch to these electronic cigarette type of devices. And the National Health Service actually supports this. And that's in England, but that's obviously looks quite different across the globe, and it's just for obviously those policymakers to make their own individual decisions for each of their countries. But we can never say that there's no harm to electronic cigarettes. It's just we don't know. We just know that the harm is probably going to be a lot lower than smoking. But we do have a problem with our children and young people with the uptake of that, and that's something that we have to try and tackle as well. So that's something globally that needs to be looked at.
Well, thank you. And I'm sorry to interrupt, but I will just say that Sean has put in the chat box the link to the Cochrane review that you have just mentioned, Darush. So thank you, Sean, for that. And thank you, all the speakers, for adding to the chat box a number of resources on this topic in general and the questions in particular. So again, Darush, I'm sorry, I hand over to you for the second question.
The second one is it'll be interesting to look at the papers and research behind the different screening, because I'm sure there's tons of screening programs that pharmacies have got involved with, and it'll be good to look at all of those different studies that have taken place. But what I would say on a personal level, some of the screening that I've done over the years would be around, for example, one campaign was around, using those microspirometries to identify like lung age, and it was mainly to motivate smokers to go smoke free. So it was a good motivational tool to help patients who probably actually may have early signs of COPD. I mean, we talk about identifying patients early and in a timely manner. So it could be not only a good opportunity to stop smoking, but also actually get the right intervention and support to manage their lung condition. So that's one of the things. And we did another campaign called Know Your CO, which was your carbon monoxide. Know your carbon monoxide. That was another screening campaign, which a lot of community pharmacies got involved with, where they would identify not only smokers' carbon monoxide readings, but also people that live with smokers or people that were exposed to indoor and outdoor air pollution. So it was good. It's good to look at wider things. But these are campaigns I've got involved with personally, which I think can work really well in community pharmacies.
Yeah, and I think, Darish, that I think rather than saying screening for a particular disease, I think if there's a disease to be screened for, it's tobacco dependence. I mean, that is at the root of so many. So I think if smoking is regarded as a disease in its own right, tobacco dependence, and that's what's screened for, then think of the opportunities that creates in terms of reduction of cancers, reductions of cardiovascular disease and respiratory disease. And it's something that we can act on because we've got really effective interventions as well. I mean, that's the point. So it feels like that's the place to start.
Thank you for answering also, Sean. And I really think that sometimes campaigns have a good adverse secondary effect, which is to activate the team, the healthcare professionals themselves. So not only for the duration of the campaign or the screening program, but raise the impact goes beyond that specific day or that specific campaign, because they get more information about what kind of signs they should be aware of, what are the prompts to initiate a conversation, so I would say that it is always useful to organize screening and awareness campaigns, etc., even if only for healthcare professionals themselves, for them to become more involved and activated. I don't know, Inês, if you would like to contribute, because in the when working on the report itself, I'm sure that you collected a lot of evidence from different countries. So I don't know what you have seen the most in terms of the initiatives that were developed by different countries and organizations, those that were most prevalent and those that had the better results.
Thank you very much. Yes, like I said during my presentation, opportunities for pharmacists to engage in chronic respiratory diseases management are so many. But I want to tell one thing. There are several services that can be implemented, but we need to look at the reality of each pharmacy and also each country, because it's so different. However, for me, one of the services that our pharmacists should provide is at the time of dispensing an inhaler, to ensure that the patient will make the correct use of the device. For this, the pharmacist should demonstrate the use of the inhaler using the demonstration device or videos, like Darush said, and then ask the patient to repeat it to make sure he or she has understood the explanation. A correct explanation of the inhalation technique ensure great adherence to therapy, and these adherence are described in so many publications. So on subsequent visits to the pharmacy, it's also important to reinforce this inhalation technique. I think this is the main message and the main information that I have collected during the literature review that I have done.
Thank you, Inês. That's very informative. I will now maybe go to Sean. You have been the leader of a social movement that involves several healthcare professionals. Sometimes as pharmacists, because we don't practice at the same, as community pharmacists, we don't practice at the same setting as primary healthcare professionals, except in the UK where we have more pharmacists working in GP practices. But sometimes we are worried about role encroachment and how will other healthcare professionals look at what we are doing in community pharmacy. So I was wondering, from the point of view from someone who has been coordinating and working with the different healthcare professionals, what do you think do you think that other healthcare professionals are prepared for the pharmacist to assume a more active role in respiratory care? And how can we make sure that what we do is used by other healthcare professionals as a way also to achieve their own objectives? Overall,
okay.
How do you think we can collaborate?
If I get this one wrong, I'm in trouble, aren't I? Well, I think what is the driver behind a lot of the concerns? I think the real driver is time. That's the biggest pressure in healthcare systems across the world. There isn't enough time to devote to patient care. And so what the driver of the concern of a GP, of a family physician, is the action of the pharmacist going to create more work for me, create more time, because they're going to send patients back to me who I think I've done a good job on, or, that's the sort of concern they may legitimately have. So this is about demonstrating that the added value of the pharmacist to reduce the time pressure on a GP or another member of the primary care team. And, like a really simple thing, and I may have mentioned this before, is it works both ways. It's also making sure that the physician is not creating extra pressure on time of the pharmacist. So if the only way you can communicate is on a phone line, which is the same phone line that the patients use to book appointments, then it's never going to work, is it? So it's easy things are where you're in a locality where there are only a few pharmacists who might be supporting one general practice, one family physician office, where you could exchange mobile phone numbers so that you've got a direct line to people. That would be, to me, a really powerful indicator of trust. Mm-hmm. So I think that, firstly, it's demonstrating you can have sensible, evidence-based conversations and communication. You've got to make that possible. And then that's what people will be doing. They'll be making judgments about, has this added value to me and my time and my team, and to the patient. So we've got examples in low-income countries where it's working brilliantly, and we've got examples in high-income countries where it's working terribly. And so money is another factor, but who gets the reward and who gets the reimbursement, and that requires strategic involvement by FIP and by IPCRG and other organisations. That if it's taking away money from one bit of the system to give it to another, there's going to be trouble, which needs negotiating. So I think that there are practical things that can be done about building trust, and then there are some strategic issues that need careful negotiation. But we've got some really amazing examples of where it has worked, and everybody's just seen the light and gone, this is time saving, this is fun, this feels like a team, we're making a difference. That's what we're aiming for.
Yes, and it works. It should come from both sides, like top down and bottom up. So we are able to change at the local level, but we also should make our institutions, our representative institutions, talk to each other, and also at the institutional level, start talking about how we can better collaborate for the patient benefit, definitely. So we are almost at the end of our presentation for today, of our session. So I don't know if any of the panelists would have like a really short take-home message that they would like to convey apart from the important contribution that you have already done during your presentations and this Q&A session. I will give you the opportunity to do so.
Emma, I'll just reinforce, now is the time to speak up. I mean, we have had 3 years of unprecedented emphasis on lung health. And I think that when it comes to COPD, we have to realize, again, there are 3 to 4 million people dying every year due to this public health crisis. So now is the time, speak up. And certainly we will be advocating on behalf of the pharmacist community in that care coordination and comprehensive care management.
Thank you. And that's a very powerful statement coming from someone who expects the pharmacist to be up to par to what our mission is. So thank you for that. So if we finalize, then I will just convey the message that the recording of this episode will be made available on FIP.org website. So again, I will invite you to provide your feedback to webinars@fip.org if you have any suggestions, recommendations, so that FIP may continue to improve our digital event offerings. I would like to thank all the panelists for today. Thank you very much for your presentations, your participation, and most of all, your work, your daily work to improve practice for patients and to provide better care for patients. And I would also like to thank FIP staff in general and Inês in particular and the team at the FIP office for a really interesting transformation program and for involving individual pharmacists in this strategy. So thank you very much to you all. And have a really nice COPD day. And I hope that this is the launch of further activities in your respective countries. Thank you very much for participating.
Thanks for sharing.
Thank you to all.